really is a privilege to host this panel of accomplished, innovative leaders in the effort to ensure the educational, social, and economic development of women and girls in Armenia. For over 25 years, Aiwa has been dedicated to empowering Armenian women across the globe. The organization was established in 1991 by 3 pioneering women, one of whom is with us today, Dr. Barbara Margarian. This uniquely independent, non-political, non-sectarian organization run by Armenian women and devoted to the particular interests and concerns of women everywhere. Since then, Aiwa developed affiliate branches and interest groups across the world and expanded its network to connect with other women, men, and organizations who share our goals of gender equality and equity. To do so, Aiwa awards scholarships, promotes arts initiatives, supports programs and interventions, and convenes national and international conferences and smaller local discussions on key issues for Armenian women, as related to both Armenia and the diaspora. Our 3 panelists have been working in Armenia on a range of very important fronts, each moving the needle in their respective domains. Their work is not without challenges, cultural, geographical, for example, but their models demonstrate that the health, education, and socio-emotional well-being of Armenia's women and girls, and ultimately, therefore, men and boys, are well within reach. This is all the more reason why I'm thrilled to moderate our discussion today and introduce you to this panel of exemplary leaders. I also would like to thank Aiwa's president, Ani Karajan, for traveling from Boston to be here today, along with many of our members from both coasts. To my left, Dr. Kim Hekimiann is Assistant Clinical Professor of Nutrition and the Associate Director of the Medical Nutrition Program for Health Professionals at the Institute of Human Nutrition in Columbia University's Medical Center. She also holds an appointment at the American University of Armenians Gerald and Patricia Turpanjan School of Public Health, where she has previously served as the Associate Director of the MPH program and Director of the Center for Health Services Research and Development. But importantly, Kim really helped lay the groundwork for the formation of AUA School of Public Health, and she has been there every day since. Marilu Papazian is CEO of the Simonian Educational Foundation and Director of the TUMO Center for Creative Technologies. TUMO has been the literal definition of a game changer in Armenia. Youth across the country have benefited tremendously from Marilu's ambitious leadership over the center's world-class opportunities to learn and experience technology as it intersects with design. Andrea Montalbano is co-founder of GOALS, which stands for Girls of Armenian Leadership Soccer, which grew from her love of the sport as a Harvard University Hall of Fame captain and coach. A writer and broadcast news producer, Andrea knows a great story, and she has created one through the GOALS program, which, as it grows in demand, diminishes the long-standing biases and stereotypes that have constrained Armenian girls' access to sports and leadership opportunities.
In a very brief amount of time, I'm going to try to go through and give a conceptual framework of the salient public health issues facing women in Armenia from the life cycle perspective. So I'm going to start with the babies and go through to adulthood. It is a somewhat unique situation in that 2/3 of the population in Armenia lives in urban areas. About 1/3 is in rural areas. And when we talk about public health issues, really we're talking about issues that are representative of both the rural and urban women populations in Armenia. There are a few exceptions to that. Water and sanitation access is significantly less in the rural areas. I feel for public health reasons is the lack of access to healthcare services in the rural areas. Very important and very different about Armenia when it comes to the context of doing health education or health interventions. It's a very small population, 3 million people. Armenia gained independence in 1991. It's a relatively young country. It's ethnically homogeneous, which when you're doing national health education or health policy, it's very helpful. And in addition, they're universally literate. So very different than some of the other countries where we work in global health. there's been a lot of difficult economic barriers to growth, war, blockade. There was an earthquake 30 years ago that Armenia is still feeling the effects from. So what are some of the salient issues in the life cycle of women in Armenia? Let's start, of course, with the babies. I think wonderful success stories of Armenia is the promotion of optimal feeding. So breastfeeding is healthiest, it protects babies from infection, lowers the risk of diabetes, there's higher cognitive development associated with exclusive breastfeeding, and so on. But unfortunately, when Armenia first became independent, and right after the earthquake, a lot of infant formula was sent in to the country, and to the point where 900 metric tons of formula was being sent annually. This was at a time when infant mortality was on the rise, and actually this infant formula as humanitarian assistance led to an increase of infant mortality for a lot of complicated reasons, and luckily the government and USAID and UNICEF decided to do a national breastfeeding promotion campaign, and I was very privileged to be a part of this campaign. There was a lot of formative research that went into it, and what were moms saying? I put this up there for those of you who don't read Armenian. Moms were saying that their milk was insufficient, there was no milk, or the child was crying. This is why they felt they needed to give infant formula. For those of you from any country, from the US, from Africa, you'll know that these are the same comments that women make around the world when thinking about supplementing their breast milk. And so the solutions were also things that were evidence-based solutions from other countries and other examples. Social media campaign promoting baby-friendly hospital initiative and promoting exclusive breastfeeding. A singular success story in Armenia that with very little inputs, the nation went from zero exclusive breastfeeding to hovering right around 50%. So what happens though after breastfeeding issues? And this is a question about basically, after you finish exclusively breastfeeding, what's happening to the nutrition and health of young children? Armenia does have excellent vaccination coverage, which is great, but there are some concerns about malnutrition in the younger ages. And this is a graph that shows stunted growth in children on the left and overweight issues. So we have what's called the double burden of nutrition in Armenia, as most of you have in your home countries as well, where we have still undernutrition in some of the young ages, but also we're seeing overnutrition or overweight and obese children as well. So I'm not going to spend much time on the teenage years because our other panelists are going to talk about their work with teenage girls, but from a nutritionist perspective and a public health perspective, I would say this is a key area because you have to go into pregnancy with a full tank of nutrients. If you don't have a full tank of nutrients as an adolescent, you are going to be you're going to be malnourished as a pregnant woman, and in your delivery of your baby is going to be disadvantaged. So, what about pregnancy? This is a big area of interest and concern. Nutritionally, there's not a lot of data on what pregnant women are eating. Pilot data showed that, like we suspected, even in the best seasons for food, even in the most plentiful seasons of food, we have a deficit in iron and in folate of women of reproductive age. So that means walking into pregnancy, there are issues with nutrition. But what I want to talk about here is a couple of hot button issues. It just shows that the fertility rate is below replacement level of 2. Pregnancy outcomes in Armenia. The former Soviet Union was a country that promoted free on-demand abortion services, and that legacy continued in Armenia as Armenia is part of the former Soviet Union. So up until 2005, about 50% of all pregnancies resulted in an induced abortion, but that number has decreased. There have been a lot of interventions to try to decrease the abortion rate. Very interestingly, I mean, women are facing the same chronic diseases in Armenia that they're facing here in the United States. The overwhelming majority of women past the age 50 in Armenia are overweight or obese. And with that comes diabetes, heart disease, and cancers. And unfortunately, the infrastructure is such in Armenia that neither for men nor for women is there really a good system to handle the treatment of chronic diseases very well. So as a result, you're seeing about half of all deaths in Armenia are from cardiovascular disease. Diabetes is like the third leading cause of death in Armenia. And it's really because of poor management of the disease. All of these diseases are diagnosed late. They're diagnosed in an acute setting. There is not a culture that really promotes prevention or checkups or the regular consumption of medicines to prevent the onset of something more acute and chronic disease.
At TUMO, we have 4 centers, one in Yerevan, one in Stepanakert, Artsakh, one in Gyumri, and one in Dilijan. And they take in charge of their own education. We have created an after-school program free of charge for 12 to 18-year-old teens. 40% are girls, 60% are boys. A lot of people ask me why 40 and 60, why you don't push it to get 50% or more. I always have this answer. We have a problem in Armenia keeping the boys in education. And things are changing, a level plan in Armenia, and it's going to affect more and more the relationship between the boys and the girls. So pushing the boys into education is very important. What do? We offer a program that considers all these areas: animation, programming, writing, music, new media, photography, and everything. This is like a menu of items from which the students pick. Because of the big amount of students, we have created a very interesting interface where the self-learning is very important, which take them into the workshops. And the workshops have a workshop leader, like you see here in the picture. Have 10,000 students per week, 10,000, literally 10,000 are getting in and out and learning. We are going to open in Gorp a center next year. It's under construction now as we speak. And this is the first TUMO center in a rural area. It's going to be an amazing center, very modern, in a very dangerous area of the northeast of Armenia. As I told you, we have a center in Dilijan, we have a center in Gharapa, Artsakh, we have a center in Yerevan, and we have a center in Gyumri. That's Gyumri, Dilijan, Yerevan, and Stepanakert are the existing centers. Masis and Gorp are under construction. Gorp is going to open in 2019. Masis design just started, but we have the funding. And why do we want to spread? Because we want to make sure that every young adult in Armenia from 12 to 18 has the opportunity to participate in this program. And this kind of environment is very important to start creating the level and an equal platform for boys and girls.
Goals believes that sport is the perfect medium for promoting a healthy lifestyle, changing gender stereotypes, and building confidence and leadership skills in young women and girls. So I think I'm just going to briefly tell you how we were created. We're very young, we're only 3 years old. A little bit of our history, our vision, and our impact. Goals was sparked by a comment by the president of the Football Federation who said, no self-respecting father would ever take his daughter to play football, soccer. What they really wanted me to do was to coach the national team and help them win games. And I said, well, I'm happy to help coach the girls, but that's not really going to help your country or the girls in it to be better athletes. What they really need is the opportunity to play whenever they want to. And that does not exist. It did not exist at the time. I spent a week with Ambassador Heffern. There we are. And I did coach the national team, but what really changed everything was when we went to one of the villages. We went to Armenia village, and I had a conversation, and the theme that has remained for goals is really that girls can play and that change is possible. And I used the example of my own life as an athlete and then a scholar athlete, and all the opportunities that Title IX had afforded me in my lifetime. Had to really discuss what's the philosophy. Are we really just trying to make soccer players? No, we're really not. We're trying to make leaders. So we partnered with coaches across continents, and they decided to come for 3 years. So they came for a year, the first year, and we spent 10 days traveling around. Let's see where we are. Oh. We spent 10 days traveling around Yerevan coaching the coaches. And what that means is that we train the NGO workers, the community leaders, the coaches, and any community educators in these games that promote discussion and social change, and in particular, gender equality. So the vision of goals became much, much clearer. It was not just to play soccer, it was to empower these girls, and we focused exclusively in the rural villages. We have to identify a local leader. We have to make sure that the girls have safe spaces in which to play. We have to convince the parents that they should be allowed to play. There are a lot of barriers to these, to just even being able to join the team. You know, they don't want them to get hurt. So this is part of the Ask for Choice curriculum of Coaches Across Continents, and ASK stands for Attitude, Skills, and Knowledge. And what we're trying to do is provide those for girls to empower themselves, to encourage them to ask questions about their lives and ask questions about their opportunities. For example, where do women wish to have more choices in their life? Do women have a voice in their community? Can women be leaders in their community? We want people to begin to question what traditions have told them about the role of women in their own society. So I'll talk very briefly about our impact so far. We're very young, but we are now in 5 regions, all focused in rural villages. Our direct impact so far is 2,300 youth and youth workers. We're in Lori. Oh, please forgive me. I'll say the names. Lori, Tavush, Sionik, Vansor, and we're starting in Shirak this year. Our goal is to have a league in every region. We also do after-school clubs where we include boys, because we have seen great changes in that the boys are more accepting of playing with the girls. And so when we have the after-school clubs we're in 10 different communities, we make sure that it is 50% girls and 50% boys. And then, you know, I was just there last weekend with my husband, and we were at a tournament at the U.S. Embassy, and there were boys playing with girls, and the girls were diving hard, and the boys weren't blinking. And that was something that really I couldn't have imagined just 3 years ago. So we feel like it's very important for the boys and the fathers, as you see, to be a part of the conversation and a part of the change. A wise woman next to me, I quote you often, and you may not know this, I believe firmly that it's great when we have a bunch of women in a room agreeing with one another, but what really matters is that we bring in the whole community to the conversation to actually foster true change.